Welcome to Prescription for Primary Care. I'm Rebecca Ramdahal, your host for today's episode. I am a digital specialist working with Healthion to help revolutionize primary healthcare in Canada. Today, I'm very excited to be joined by Dr. Alex Nataros, a full-service family doctor at the North Island Community Health Center in Port Hardy, British Columbia, located on the northern tip of Vancouver Island. Dr. Alex, thank you for joining us.
Thank you, and I appreciate the opportunity to join. We're joining from Quaugil Territory, which is one of our First Nations communities here in Port Hardy on the northern end of Vancouver Island. And yeah, it's a pleasure.
Thank you for joining us. So let's get right into it. So you work in a rural community, right?
Yeah, that's right. So Port Hardy is about 4,000 people. It's, off the northern tip of Vancouver Island. And Vancouver Island overall, we've got about 1 million people, but the far majority, like 95% of those, live on the south end of the island. So we're 3-4 hours away from any specialist care. So it means that as family doctors, we are it, right? We're here and we need to manage what we face that comes in through the emergency room doors or comes in through the clinic doors.
Oh boy. So you have challenges basically.
There's challenges, but that's what we're trained to do. So it's something that I wouldn't have it any other way. I've chosen to be here, live here with my family, and I love it, right? I love the challenges. I love working with low resources and working and improvising with the community. And it's really in a small community, it's all hands on deck. You're working with the paramedics, you're working with the nurses, you're working with the midwives, you're working with the healthcare aides. Everyone that can contribute plays a role.
So you guys have a team-based care, basically. So that's interesting that you have midwives as well. I don't hear a lot of doctors even mentioning midwives in a conversation.
Oh, 100%. We do low risk obstetrics up here. So the closest cesarean section is 3 hours away in Campbell River. So it has to be low risk to accept it. Of course, there's always surprises in terms of the cases that show up at the door, women in labor, and they can't make it all the way down the road to Campbell River to where they'd need a cesarean. But this is a community where midwives do all the primary care obstetrics. And so it's fantastic, right? Because it means that someone can specialize in obstetrical care. I provide some support up to 20 weeks, 25 weeks gestation, and then the midwives take over. And that's really a model that we're working with at the North Island Community Health Center here in Port Hardy. And it was certainly my vision in starting the Community Health Center is to create a multidisciplinary center. And so I work alongside a chiropractor, a physiotherapist, a registered massage therapist, a foot care nurse, and an orthotics fitter. So you can see in a relatively small, isolated community, we've been able to attract a lot of healthcare workers, some of whom come from outside the community. And so, what I've done, and my goal has been to recruit some of these healthcare workers and to subsidize their overhead. So, I've built this community health center and I provide space for the massage therapist, for the physiotherapist, for the chiropractor that's free for them.
Okay. And do you have nurse practitioners in your team as well?
We don't actually, and the challenge there is just frankly the cost, and we don't have a model where the nurse practitioners would pay for themselves, and I can't afford to pay the salary of a nurse practitioner.
Mm-hmm.
That said, we do in our community have two nurse practitioners. They work separately from our North Island Community Health Center, and they do a lot of outreach work in the First Nations. And they're invaluable members of the team. They're trained differently from physicians. Nurse practitioners are not trained in diagnosis the same way that doctors are, but they have, good skills, nursing skills, and they're able to work through treatment algorithms and approaches and offer very good care, right? In terms of primary care, there's no doubt in my mind that nurse practitioners are part of the solution.
Yes, well, I agree with you there. So there was a recent CIHI study, or it came out with data that showed we had 243 physicians per 100,000 Canadians in 2023. But while specialists grew by 2.9%, family medicine declined by 0.1%. Is this, do you see this impact in
There's no
your area?
there's no doubt that the shortage of family doctors in urban and especially rural areas is impacting, the care and outcomes in the Canadian population. And what we know from around the world that is reproduced time and time again is that the health of a population is determined by the access to primary care. There's no better determinant of health outcomes. And so, if we want a healthy population, we need a healthy access to primary care. That is, family doctors and nurse practitioners and physician assistants. And so, what I see here is that we've worked really hard in our rural community to recruit family doctors and create favorable conditions for team-based care. And honestly, we've had some success. So I'm shortly going to be going into work at our walk-in clinic that we offer prior to my morning routine clinic. And it's easier to see a family doctor here in Port Hardy than it is at the other end of Vancouver Island in Victoria. And so that's something that is kind of neat to say, right? And it wasn't always that way. We've turned that around in the past 2 years. So what's, hopefully inspirational is that you can see in a rural community that with a little bit of leadership and hard work, you can actually provide good primary care. And a team-based approach is so essential to that. In Ontario, Dr. Jane Philpott has done an incredible job leading primary care reform and outlining how we can have a primary care home in each community. Much as you'd have, we as Canadians, we take for granted that we have a school that we can send our kids to. We need to have that same model where everyone has a family doctor or a primary care lead. And it's not hard to do. It takes a little bit of vision, a little bit of leadership, and then a willingness to say, this is what we need, and this is what you're going to deliver to politicians. And so, one of the really exciting advances in British Columbia has been what's called the Longitudinal Family Physician Payment Plan, LFP. And this is quite new. This is in the past year and a half.
Mm-hmm.
This is a new payment model. And, frankly, at the end of the day, money talks. So we got to approach this in terms of financial benefits. And this is a system where family doctors are paid to do paperwork. And so, in my day to day, I get paid to see patients. And it used to be that I would only get paid to see patients. And we hear these stories, especially from doctors across Canada who are in other payment systems and in fee for service payment systems, which, I've read some of the articles that are related to your podcast that were shared in terms of family doctors in Ontario. And, as family doctors, I've been up for 2.5 hours doing paperwork this morning. That's part of our work is we have to go through results. We have to stay on top of our consult reports. There's an awful lot of just the business of family medicine in terms of, keeping under that pile of paperwork and keeping out from under that pile, because it can quickly become overwhelming and it can quickly become something that you can't tolerate. And it leads to burnout, it leads to stress, it leads to depression. And, we all hear the stories about
Mm-hmm.
family doctors burning out, becoming depressed, and suicide rates among family doctors are among the highest in Canada of any profession. So, we quickly see this slippery slope where we lose our family doctors. And so we need a new system to meet the needs of our family doctors. And British Columbia is leading the way in Canada with this LFP remuneration system where you're paid to do, paperwork, administrative tasks in addition to seeing patients. And it has to be a balance. I mean, frankly, I went into medicine to see patients. I love healthcare when I can provide patient care. I don't love
Mm-hmm.
healthcare when I'm doing paperwork. So the paperwork is the worst part of my job. but at least, I'm getting paid to do it. It used to be that I would sit in my office for hours just hitting my head against the computer screen, tapping away on my results, right? And it's no longer that case.
Oh my gosh. Yeah, the paperwork, I heard it was insane. And that's like one of the reasons why a lot of young students are now basically afraid to go into family medicine, right?
That's 100% true. And, one of the exciting things that's happening in Ontario is there's a new program that Dr. Jane Philpott has spearheaded where family medicine, where medical students are entering and choosing family medicine from the beginning. And so rather than have to complete medical school and then decide what stream of medicine, right from the beginning of their training, they're deciding, I want to be a family doctor. And that's what we have to do. We have to make family medicine what it should be, which is the best way to practice medicine, where you're treating people from cradle to grave, full service, helping people the spectrum of life and the challenges and everything that, it is to be human, because it's very rewarding. And so, the goal is to make family medicine attractive, because we know that the best determinant of the health of a population is the access to family doctors. We know how to do that. We have to pay doctors and pay family doctors for their time. We need to ensure that our, youngest, our best and brightest that are coming into healthcare choose careers in family medicine. People like Dr. Jane Philpott are doing their best to ensure that's the case. And it's really exciting. And, what we're trying to do here off the northern tip of Vancouver Island in Port Hardy is to prove that team-based primary care can be done effectively. It can be led by doctors, which I strongly believe in. I believe doctors should lead healthcare, not bureaucrats, not politicians, and that we have to be central to the
Yes.
response, because that's what we're trained to do. And at the end of the day, we have our patients' interests and our patients' families' interests at heart, right?
Going back to where you were talking about how from the cradle to the grave, basically you should, nurture the family physician. Back in 2012, there was a study that was published in the UBC Medical Journal where they're discussing the concept of a rural pipeline. So they're cultivating rural physicians from an early stage, including high school outreach programs. So we already knew about all these issues back then, and we're still seeing these challenges with rural health care and primary care. Do you think these approaches have evolved, or we're still using the same approach and that's why things are not improving?
No, I think we're making big progress, right? I think, like I said, the leadership of people like Dr. Jane Philpott in terms of leading Ontario health reforms and getting, you know, students right out of university into medical school, into a pipeline to become family doctors. That's important. And yes, we need to do so in high school, in elementary school. One of the most meaningful parts of my work, and I'm not doing it as much as I used to, but I trained in rural Manitoba, some of the northern Indigenous communities, is I would go and present in high schools and elementary schools, and I'd take blood pressure cuffs in and glucometers and just have kids, take their blood sugar, take their blood pressure. We talk about how the heart works, how the lungs work. Not complicated, but when you're in communities where, maybe 15 or 20% of the community graduates from high school and they don't see a reason, why would I finish high school? If you can go in as a highly trained medical professional and say, no, you can actually make a difference in your community. You can be the family doctor in your small community. That makes a difference. And so, yes, we need to redouble our efforts to ensure that we are raising the next generation of family doctors and healthcare providers. And so, I think it's important that it is a matter of all hands on deck. And as family doctors, we need to remember that our job is to mentor the next generations of care providers. So that pipeline isn't lost. And, very much it's in the spirit of medical education. And part of our Hippocratic oath is committing to educating the next generation of providers.
Okay, wonderful. So to wrap up, Dr. Nataros, based on your experience as a rural doctor, What do you think is the most important thing for our listeners to understand about the challenges facing rural healthcare in Canada?
So, I think we need team-based care. We need physicians to lead those teams, and we need to train more family doctors. We need to empower family doctors with physician assistants, with nurse practitioners, with other allied health providers. And, mostly we need to cut the red tape. We need to make sure there's less forms, less paperwork, and make sure the paperwork that does exist, we're paying family doctors to complete, like British Columbia has done with the LFP program.
Wonderful. Thank you, Dr. Nataros, for sharing your insights with us today. We really appreciate you being on the podcast. So to our listeners, thank you for tuning in to Prescription for Primary Care. We hope this episode has shed light on the crucial challenges facing rural healthcare in Canada through the eyes of a rural physician. Please subscribe, share, and comment on our socials. Until next time, I'm Rebecca Ramdahal, wishing you good health and better healthcare.